Let's begin with what you can see and feel, the visible signs of a condition that runs much deeper than the skin. You might notice red, raised patches of skin known as plaques. These areas can feel sore, tender, or intensely itchy. Often, these plaques are covered with silvery scales, which are a buildup of dead skin cells. They commonly appear on the elbows. You'll also frequently find these silvery scales on the knees, another classic location for this condition. It can affect the scalp, causing an itchy, burning sensation that flakes like a snow globe, often mistaken for severe dandruff. The nails aren't spared either. You might see nail pitting, tiny dents or depressions on the nail surface. Or you could develop thickened yellowed nails that may even separate from the nail bed. This is psoriasis, and it's crucial to understand that it is absolutely not contagious. It's an autoimmune condition, not an infection, so you can't catch it from someone else. So, what's happening under the hood? Let's look at the science. In healthy skin, new cells are made deep within the layers and take about a month to rise to the surface, where old cells then shed. It's a balanced, orderly process. But with psoriasis, your immune system hits the gas when it should tap the brakes. It gets its signals crossed and goes into overdrive. A specific type of immune cell, called a T cell, mistakenly attacks healthy skin cells and shouts, "Make more skin." This command sends skin cell production into hyperspeed. New cells pile up in just 3 to 5 days, not a month. The body can't shed these extra cells fast enough. That traffic jam turns into the thick, scaly plaques you notice first. Now, psoriasis isn't one size fits all. There are different flavors. Plaque psoriasis is the classic and most common form, the one we've mostly described. Guttate psoriasis appears as small, drop-like spots, often triggered by a bacterial infection, like a sore throat. Inverse psoriasis hides in skin folds, like under the arms or in the groin, appearing red and shiny, but usually without the scales. Pustular psoriasis is less common and causes pus-filled bumps, which can be widespread or localized to the hands and feet. And finally, erythrodermic psoriasis is a rare, severe form that can turn most of the body bright red, causing intense itching or burning and making you feel very ill. If that happens, it's a medical emergency. Get help fast. So what causes a flare-up? Let's talk about triggers. Stress is a major one. High levels of emotional or physical stress can kickstart a flare. Cold, dry weather can also worsen symptoms by stripping moisture from the skin. Skin injuries like scratches, bug bites, or even sunburn can trigger new plaques in that exact spot. This is known as the Koebner phenomenon. Even fresh tattoos can count as a skin injury and potentially set off a flare. Certain medications are known triggers, including some beta blockers used for high blood pressure. Lithium, a mood stabilizer, is another well-documented medication that can trigger or worsen psoriasis. Smoking not only triggers flares but can also make the condition more severe and harder to treat. Heavy alcohol consumption is another significant trigger for many people. And infections, particularly strep throat, can provoke that first outbreak of guttate psoriasis. It's also important to know that psoriasis can team up with psoriatic arthritis, causing swollen, stiff, and painful joints. The chronic inflammation from psoriasis also raises the risk for heart disease. It raises the risk for metabolic conditions like type 2 diabetes, and the emotional toll is real, which is why it also raises the risk for anxiety and depression. So, what helps? The good news is there are many effective strategies. Let's start simple with daily care. Use thick moisturizers or emollients daily to lock in moisture and reduce scaling. Opt for gentle, fragrance-free cleansers that won't strip your skin's natural oils. Take short, lukewarm showers. Hot water can be drying and irritating. A little bit of safe, limited sunlight can sometimes improve plaques, but avoid getting burned. Since stress is a key trigger, it's vital to manage stress through practices like mindfulness or exercise. If you smoke, making a plan to quit smoking can have a huge impact, and go easy on alcohol, as moderation can help prevent flares. Finally, maintaining a healthy weight through diet and exercise can reduce the severity of psoriasis. When lifestyle changes aren't enough, treatments scale up. The first step is often topical steroids to reduce inflammation. Vitamin D creams can also be used to slow down skin cell growth. For sensitive areas like the face, calcineurin inhibitors are a non-steroid option. The next level is phototherapy, which uses controlled UV light in a clinical setting to treat the skin. For more severe cases, there are systemic meds that work throughout the body, like methotrexate. Another systemic medication is cyclosporin, which suppresses the immune system. Then there are biologics. These are advanced, targeted drugs that block specific parts of the immune response, like those that target TNF. Other biologics target inflammatory proteins like IL-17, and some biologics are designed to precisely target IL-23. A newer oral option is a TYK2 blocker, which also works by calming specific immune signals from within. With so many options, a dermatologist is your best partner. They can help you navigate the choices and tailor a plan that's right for you. The bottom line is this: psoriasis is a real medical condition, not just a cosmetic issue, and there are real effective tools to manage it. So, track your triggers to understand what causes your flares. Treat it early and consistently to stay ahead of the inflammation, and just as importantly, protect your mental health. You are not alone in this.